Next to calls from those working in rural communities across Lincolnshire for more specialist mental health support for people who can often fall through the cracks.
Yes, isolation, the cost of living and the impact of weather all contribute to farming communities struggling more with mental well-being than the general population.
But the government has just rejected a recommendation from a cross-party report that there should be dedicated mental health support from rural communities. Amelia Beckett now reports.
15 over 19.
Today, these cows are being tested for TB. For a cattle farm, it is a legal requirement. But when Becky needed support for her own health, accessing that proved far more difficult.
I rang the doctors a few weeks ago and said, look, I'm really struggling with my mental health, and I was told to ring crisis team. So contacted crisis team. Their first thing that they said to me, have you tried to kill yourself? No, I just want to run away. Well, I'm sorry, we can't help you. So you've got to actually be at that point before anybody is willing to help. And normally when you've got to that point, there's no coming back.
She's one of thousands of farmers across the country struggling with their mental health, impacted by isolation, increasingly unpredictable weather and money worries, which farm vets like Molly also feel the impacts of.
Some of the things we have to do on farm, for example, like TB testing, is a government decreed thing to do. It is a very important thing that we TB test, but the implications can be huge. And so telling a farmer, for example, that you need to shut their farm down and stop them trading because there's TB is hugely emotively difficult to do because you understand all the consequences of that.
There have long been concerns about mental well-being within farming communities. Latest figures suggest that 21% are probably depressed, while 47% are suffering with some form of anxiety.
But support can be so hard to access, it's often left to charities like the Lincolnshire Rural Support Network to fill in the gaps.
So our referral rate is going up. Over the last 5 years, we've had a 229% increase in those people coming to us with some form of mental health issue. This year alone, we have worked with 5 people who have come forward and said if it wasn't for our support, they would have ended their lives. And I think there's many more out there who haven't yet come forward.
It's that which led a recent report of cross-party MPs to call for a specialist rural mental health team. But the government has rejected this, instead saying their suicide prevention strategy will work to include rural communities.
10, 11.
For people like Molly and Becky, this is a job passed down through generations. They fear without support for the challenges it brings, many may choose to walk away. Amelia Beckett, ITV News, near Louth.